started, everybody. Welcome. Thanks very much for joining us today. Just to let you know, we are videoing the event as well, so everyone should be on their best behavior. Very happy to see you all. Thank you to GHC for hosting this fantastic symposium. I'm Nigel Sizer. I'm the Executive Director of Preventing Pandemics at the Source. And this session is on win-win strategies for people on the planet and the planet, focused on pandemic prevention. We're a coalition of about 20 organizations, including some of the major public health nonprofits like JPIGO and the Task Force for Global Health, some of the world's leading environmental organizations, human rights groups like Right to Health Action, Indigenous peoples groups like the Tenure Facility, and some really important and interesting organizations that work in between all of this, like EcoHealth Alliance and Health in Harmony, and so on, who've been pioneering work in this space for many, many years. And our goal is to galvanize interest and attention and funding and political support, policy action to support prevention of spillover, actions that actually contribute to stopping future pandemics before they start. And this, of course, is really important because all viral pandemics since the 1900s, since the Spanish flu, and probably many before that as well, begun with the spillover of viruses from wildlife into humans, almost certainly including COVID-19. And the incidence of this is increasing. We know that the rate of spillover and outbreaks is growing. The risk that those will translate into epidemics and pandemics as more and more people move around the world at high speed, and as more and more people encroach on nature with deforestation and the wildlife trade, intensification of animal agriculture, and so on. The good news is that there's a lot we can do about this, and that's what our coalition is focused on, whether it's working on the wildlife trade and addressing risks associated with that, which of course is highly relevant, presumably, to the origins of COVID-19, stopping large-scale deforestation and forest degradation, potentially very relevant, for example, to things like Ebola, addressing livestock health, intensification of animal agriculture, heavy use of antibiotics and crowding of animals, leading to greater risk of emergence of new flu varieties and so on, swine flu, bird flu, and so on, spreading through livestock to humans. Improving primary healthcare. We heard a lot in the conference about the importance of that. Primary healthcare in frontline communities, rural communities that are living very close to wildlife, and enhancing surveillance, particularly at the interface of humans, wildlife, and livestock. So these are the actions that we're promoting and calling for a much more comprehensive approach to pandemic prevention and preparedness, while continuing to invest more and more in the containment efforts around vaccines and so on, balancing that with significantly greater attention to these primary prevention activities. Now, to start us off today, I'm very happy to introduce Jim Levi. And Jim will have to leave at about 11, so he's going to make some remarks and then we can take a few questions. Jim is the Deputy Assistant Secretary for Science, Space and Health and Director of the Office of International Health and Biodefense with the Bureau of Oceans and International Environmental and Scientific Affairs with the State Department. Jim, over to you. Thanks for being with us.
Thank you so much, Nigel. You mentioned the Spanish flu. I just came from several years in China, and that reminded me of outbreak there from a few years before the Spanish flu, which is a pneumonic plague in Manchuria. I think it was 1910 or so. And again, it was exactly what you were saying. It was the introduction of non-traditional techniques for hunting and trapping marmots was quickly identified even then as the source of that particular zoonosis. And that one, I see a lot of you wearing masks. I was wearing one a minute ago. That was the first time I'm aware of in human history where the members of the public were instructed to wear masks, not just the doctors and caregivers. We've had the problem a while, and we do definitely need to take a comprehensive approach to it. So thank you, Nigel. As said, I'm the Deputy Assistant Secretary for Science, Health, and Space at the Bureau of Oceans and International Environmental and Scientific Affairs. I didn't name the Bureau at the State Department, where I work for our Assistant Secretary, Monica Medina, who's very interested in these areas. Unfortunately, I'm here instead of her because she's in New York for the Law C conference today, but it's a pleasure for me to be here. I've spent most of my career in embassies and consulates around the world, where I've seen firsthand how global, borderless issues like emerging disease threats, like climate change, impact people everywhere. And yes, I'm a veteran of SARS-1, now SARS-2, and also H1N1 in 2009, among other infectious disease threats that we've faced at our missions overseas. In my current role, I oversee our work to strengthen global health security worldwide so that we're better prepared to prevent, detect, and respond to infectious disease threats. Our team does this work in a multitude of ways. There is no one-size-fits-all approach to these activities. We work in multilateral and bilateral forums through funding innovative and novel programs, through diplomatic engagement, and through other avenues. Advancing and integrating multi-sectoral One Health approaches that recognize the critical connections between the health of people, animals, both wild and domestic, plants, and their shared environment in this space is a key component of this work. One Health approaches are foundational to preventing and reducing zoonotic spillover. This is a straightforward reality, but implementing these approaches requires deft diplomacy, careful attention to science, and foreign policy insights. Effectiveness in this area often requires recognizing these multi-sectoral connections and looking beyond traditional public health interventions. For example, we know that well-managed conservation activities that address the needs of local and indigenous communities, curb illegal wildlife trade and logging, and promote rigorous disease surveillance can be successful for primary prevention. And at the same time, interventions like these yield positive benefits outside of zoonotic spillover prevention and reduction. For example, many of these interventions provide climate benefits by saving carbon sinks and help as well to slow biodiversity loss. But these multiple benefits often require working across sectors of governments and societies. The links that support this kind of cross-sector work don't always occur naturally. Trust me. Foreign policy actors can help connect the dots, broker connections, and can help fund the catalytic work of getting people and systems to work together. Advancing these One Health approaches, including to address spillover prevention and reduction, is one of my Assistant Secretary's top priorities. To prove effective, a One Health approach must be utilized by all actors involved. It is an area of work our partners and colleagues throughout the U.S. government continue to elevate and to prioritize, including by recognizing the importance of reducing zoonotic pathogen spillover in our new National Biodefense Strategy and Implementation Plan, or NBS. Critically, this is recognized as both a domestic and global activity, and the Department of State is one of the lead agencies for global capacity strengthening activities in this space. We'll continue to collaborate closely with other U.S. government partners working in this space, and we look forward to further advancement and integration of One Health approaches in our work, and to raising awareness about the importance of these activities wherever we can. And before I hand things back over to Nigel, I want to take a moment to thank you all for being here today and for continuing to elevate critical conversations in this space. The last 3 years have made clear that an outbreak anywhere is a threat everywhere. COVID-19 has taken lives, wreaked economic and social havoc, and has devastated communities. And we know that prevention is almost always more cost effective than response in terms of dollars spent, in terms of well-being, and in terms of lives. Decades of investment in global health security capacity strengthening have driven progress, but there's more to be done. Our team here at the State Department and at all of our embassies and consulates overseas around the world, we look forward to continuing to further this work in partnership with each of you. So thank you very much.
Thank you, Jim. I think we've got 5 more minutes with you. So I'll start off with a question, but then if anyone else has a question, I'll come to the audience right after that. Jim, I wonder if you could just say a little bit more about what you see as some of the specific challenges and opportunities you see on the international diplomacy side in helping to address spillover risk.
Well, we have the benefit of enhanced attention to the topic, a topic that people at the highest levels of government speak of openly in a way that simply didn't happen a few years ago. What's on the other side of that? All kinds of other human activities. Fishing, logging, and one we hear more often about now is environmental threats that relate to critical minerals and efforts like that needed to advance other agendas, this and other administrations and governments. So we need to make sure that multiple lines of effort are aligned and not in conflict. And I think you'll find my boss is very attuned to that, because Monica Medina is I mean, she epitomizes the One Health, but she's also looking at rainforest in the DRC and how to obtain critical minerals in a way that supports local and indigenous communities and that preserves the environment.
Great. Does anyone have a question for Jim? Yeah, Pranav, please.
Hi, Jim. Thank
you
you
just
so much.
introduce yourself.
Hi, Jim. I'm Pranav from Right to Health Action. Thank you so much for speaking and being here, and also representing the State Department on this. It's great to know we have allies working on this really important issue, and it's great. And also, huge congratulations to the administration for passing the biodefense legislation, and strong support for zoonotic spillover and One Health and climate action in there. So the same biodefense strategy also outlines a 50-country plan for direct support, and then an additional 50 other for indirect support from the United States. And then the Global Health Security Agenda is also up for renewal. So how do we make sure that these important multi-sectoral policies, like zoonotic spillover, is embedded into the work of the United States that's working with these 50 countries directly now, and in the GHSA that's coming up?
Well, that's a wonderful question, Pranav. And very rudely, I'm not going to answer it. And the reason for that is I'm privileged today to be accompanied here by Leticia de Tezua and Danielle Gillerin. And Danielle just returned from the Global Health Security Agenda Conference in Seoul. And she can speak both to our National Biodefense Strategy, and it's not a law, it's a strategy.
Yes.
And our aspirations to get to 50 intensive support countries and to support other efforts for other countries. And I believe both Leticia and Danielle can stay longer. Is that right?
Yes, we are here, and we can certainly answer some of your questions for you. Are you trying to take questions from a group first?
Well,
or?
no, that's great. I mean, I'm watching the time here. It is 11. So, Jim, if you would like to scoot off, and then we'll just go straight to Danielle and Leticia to
That sounds
continue,
perfect.
then you'll be on time.
And I'm glad that they can remain
And
on.
then we'll go straight to you to say a few words about that. Does that sound okay?
Certainly.
So let's just appreciate you. Thank you so much. Nice to meet you. Thanks for joining us. And we'll...
Bye-bye.
Yeah, go ahead, Danielle.
Yeah, certainly. I'll try to address you right behind me, but
Thank
to
you.
the room. No, it's great. First of all, I wanted to echo Jim's thanks for everyone. Appreciate you having us here, and our huge thanks to Nigel and Lena and team for organizing this event. critical topic of importance to Letitia and I's team, something we work on day in, day out at State. So to your question on the NBS and on the 50-country expansion, so and GHSA. So starting with, I guess, the GHSA question. So the United States is a member of GHSA. We're very actively involved across our departments and agencies. Like Jim said, I just returned from Seoul at the ministerial event. We brought quite a large delegation from, I think, at least 6 departments. I'm seeing a nod in the room if you were also there. Yes, there's many of us. Quite a large delegation from across sectors. I think 6 departments and agencies, or perhaps more, were there. So we really approached GHSA from a multi-sectoral lens, which I think aligns well with this work. And we're also actively involved in, yes, I'll speak up a little bit. Also actively involved in a number of the action packages, which is kind of how they direct topical work, including work on One Health approaches and zoonotic spillover-like issues. On the NBS side, one of our colleagues who is not here today has been working tirelessly with teams across the interagency on that for a while now, and was very excited to see it published. And on the 50-country expansion, it's something our team is quite excited about. The State Department is the coordinator for our intensive support partnerships across the world. So we're closely involved in that work. We currently work in around 25. As you mentioned, we have an ambition to expand that to 50 countries by 2025. It's a multi-sectoral effort. We work with colleagues from CDC and USAID on their programming, also colleagues from other departments and agencies. The expansion itself and what that looks like, that will be a full whole of government process, and it'll be led coordinated by us here at State, and then along with other colleagues. As far as integrating approaches within that, so a lot of our existing work, so projects like USAID Stop Spillover, DoD's capacity, CDC's capacity building efforts within ministries of health is integrated within that work. And we'll continue to integrate that in expansion countries as well. Hope that's helpful for your
Thanks,
question.
Danielle.
Yes.
That's great. Leticia, would you like to add anything?
To be honest, not really. I think we
Good. Okay, great. Thanks. We're gonna move right along. We've got a 5-minute video that Lena's gonna tee up here, which was produced with help from Cornell and their ornithology multimedia lab team there, who are amazing. They donated this to our work.
Millions dead, hundreds of millions infected, countless jobs lost, trillions in losses to the global economy. These are just some of the consequences of the COVID pandemic. We still don't know the full impact. What we do know is that this pandemic happened in part because of our broken relationship with nature. New diseases are emerging faster and faster. Infectious diseases like COVID-19 will appear again unless we address the root of the problem and prevent pandemics at their source, at the point of spillover. Zoonotic spillover is the process by which viruses jump from animals to people. Just like Ebola, HIV, and now COVID, most new infectious diseases come from animals, and the majority come from wildlife. Once a new virus is in humans, containing its spread in our interconnected world can be extraordinarily challenging. Investment in containment, preparedness, and response is important and necessary, but it is not enough. Spillover prevention is essential if we want to avoid another global pandemic. The main drivers of spillover are deforestation and land use change, wildlife farming, markets and trade, and livestock production in close proximity to wildlife. Every time humans cut down forests, we increase contact between human and wildlife populations and increase our chances of a new virus spilling over. Wildlife trade and markets are another pathway for spillover, with stressed and often injured animals mixed together, creating the perfect conditions for the emergence and spillover of novel viruses. Livestock production near the forest edges puts wildlife in close contact with domestic animals, increasing the chances of spillover. And the crowded conditions on industrial farms are often similar to those of wildlife markets, with pigs and poultry serving as ideal hosts for viruses. The good news is that government-supported prevention can achieve rapid, large-scale results that reduce pandemic risk. In Indonesia, there has been significant progress in slowing deforestation over the last 4 years due to a government moratorium on forest clearing and strengthened law enforcement. In China, the national government has taken action to close wildlife markets. And in northern Thailand, villagers are able to track instances of unusual disease in livestock and wildlife through a locally built app. These solutions have important secondary benefits, like combating climate change and preserving biodiversity. But now we know that when we fight for the forests and their wild animals, we are also fighting for our own lives. The global cost of a comprehensive plan to stop future pandemics is estimated to be as little as $20 billion annually, with up to $10 billion needed for spillover prevention. This is a small price to pay compared to the millions of lives and trillions of dollars lost to COVID. The COVID pandemic has taught us that we need a new, expanded approach to global health. Now is the time for governments across the globe to address the root causes of infectious diseases and invest in preventing pandemics at the source. By doing this, we can stop the next global pandemic before it starts.
Thanks, Lena, and thanks to Cornell for that fantastic work. This is the kind of material that we're developing and taking out to policy audiences around the world and engaging in the various processes that we were hearing about yesterday. I now want to invite our panelists to come up and join me here. Neil, Ashley, John, please come and take a seat. That doesn't matter where you sit. And we're going to have a conversation. I've got some questions for them, but this is very informal, so anyone who has a question as we're going through this, feel free to put up your hands. I'll come to you and encourage that as well. So let's make it as interactive as possible. We're going to start with Neil Vora. We just saw some amazing biodiversity on the screen there, those birds of paradise. You are almost as rare as a bird of paradise. You are a former leader with the US Center for Disease Control, a medical doctor, still active at practicing medicine as well with TB clinics in New York. But you're also the Pandemic Prevention Fellow at Conservation International, so working for one of the world's leading environmental groups. And very active in our coalition. So thanks for being here with us, Neil. Tell us a little bit more about your story and why you made that transition from CDC, what you were seeing there, why you moved over to Conservation International, and why you're so active in this work now.
Thanks, and real honor to be here today. When I joined public health, that was the culmination of many years of wanting to pursue public health. My dad had smallpox as a child. He was born in India. And so when I was growing up, I would see the legacy that smallpox left on his life in the forms of scars that he still has on his body to this day, over 70 years later. And so from a young age, I knew about public health and the amazing work of public health workers that led to the eradication of smallpox, a gift that keeps giving, right? None of us really have to worry about smallpox anymore because of the work of public health. And then I watched the movie Outbreak like when I was 14 and it was over. I knew I wanted to wear a spacesuit and chase dangerous diseases around the world. So I ended up going to med school, residency, and then I joined CDC in 2012. And with CDC, I had the most amazing opportunities to have impact. I got to respond to the 2 largest Ebola outbreaks ever with CDC and many other colleagues. I was in the country of Georgia investigating a new smallpox-like virus. I led New York City's COVID contact tracing program. But I found myself increasingly responding to outbreaks like many of you in this room have been doing as well. And in public health, we've started talking more and more about One Health, but I found that we were just really scratching the surface. People like John and his colleagues, and Nigel and his colleagues in ecology have been saying for years, decades, that what is happening in nature is leading to more and more outbreaks. But I found that on the human health side, we weren't talking enough about the upstream drivers that were leading to these outbreaks, epidemics, and pandemics. And just waiting for them to occur and trying to contain them, I found to be insufficient for the scale of the problem that we're facing. And I'm sure we're going to talk about that more today. And so that prompted me last year to make the difficult decision to leave CDC to join these colleagues who've already been doing this work so that I could also support those efforts to go further upstream and prevent outbreaks before they even start. But I just add and close by saying that I have not left public health. I actually see that conservation and public health are two sides of the same coin. Conservation is public health. When we save nature, we're saving ourselves. Everything we need as humans to survive ultimately comes from nature. And if we don't have a planet to live on, we're not going to survive at the end of the day. And so for me, this is just one way to actually keep doing public health work, but just do it through a different lens.
Thanks, Neil. That's fantastic. Let's move over to John. So John Epstein with EcoHealth Alliance. He's their vice president. His work's been featured in stories in the New York Times. He's a key player in David Quammen's books about spillover and so on. He's done some amazing field work around the world over many years as a veterinarian, out there collecting bats, sampling, looking for the viruses, really on the front lines of this. Tell us a little bit more, John, about what you see as the key factors that are driving spillover, and in particular, what's clear in the scientific literature, which is this apparent increase in the rate of emerging infectious diseases over the last 4 or 5 decades.
Sure. And Nigel, let me start by thanking you for inviting me and also commending you for really assembling a One Health panel up here. You've got representations from key disciplines of human health and animal health and policy and biology. So it's a microcosm of what we need to be talking about. So this is exciting to be here. And Neil, I think you put it very well. Our health is dependent upon nature and the health of nature. And what's changed over the last century and really accelerated over the last 30, 40 years is the impact of human activity on natural systems. In effect, changing the way in which we relate to nature, increasing the contact that we and our domestic animals have with wildlife. And as you heard in the video earlier, wildlife tend to be the reservoirs or source for most of the emerging infectious diseases. Most of the zoonotic diseases that ultimately end up in human populations originate in wild animals, and they make their way into people either directly or via livestock. And so the really number one thing to know is that all of these epidemics and pandemics that we're experiencing and will continue to experience are the result of human activity, of our actions on the environment in such a way that increases the contact we have and our livestock have with wildlife and create opportunity for pathogens like viruses that would normally happily reside in wildlife populations that were living in a forest or any other ecosystem well away from people. Suddenly they have a lot of contact with us and our domestic animals. And there's opportunity for those viruses, assuming they have the genetic wherewithal, to spill over, make that jump into livestock or into people. And so you heard in that video earlier, the top 3 drivers of spillover and outbreaks. Number 1 is land use change. And so of course that is deforestation, but not only deforestation, it's any kind of land use change that dynamically changes the composition of ecosystems and changes the balance, the composition of different species that live in that environment and the way they interact with us. So land use change is really important, responsible for about 30% of zoonotic disease emergence. Then there's wildlife trade, and that is both the act of going into forests and coming into contact with wildlife through hunting and butchering, but also extracting wildlife out of their natural environment and bringing them into commodity chains like market systems that place a lot of stress on animals, that bring different species into contact that might normally never come into contact with each other, and often bring them into urban centers where there's a lot of opportunity for people to come into contact with those animals and bodily fluids as they're butchering them, using them for consumptive purposes. And then livestock production. Now, the world just hit 8 billion people. And one of the reasons that epidemics are accelerating and spillover is accelerating is that our population is increasing, exponentially. And as more and more people are on this planet, the demand for nutrition, animal protein, is increasing proportionately. And so we see a lot of intensification of livestock production in parts of the world that still have a lot of biodiversity of wildlife. And that is a recipe for disaster if those production systems that have large, intensive populations of animals like pigs or poultry or goats or what have you, if there isn't adequate biosecurity or barriers between livestock populations and wildlife. And the idea of biosecurity on farms is really nothing new in veterinary medicine. It's been practiced in a lot of places for a long time. The notion that you don't want to bring infected domestic animals into a herd, it might spread that infection and compromise your herd. But what isn't thought about quite as much is the risk and impact of wildlife having access to livestock populations, and the notion that viruses or other pathogens carried by wild animals that are very well adapted to humanized environments, rodents or bats or non-human primates, there's contact there, either directly or through contamination of food resources, that pathogens may jump into livestock populations, and then ultimately we get exposed either through contact with infected livestock or consuming food resources that have been contaminated by wildlife directly. So livestock production, but specifically without adequate barriers between livestock and wildlife, is another major driver of spillover and emergence. And so these are the kinds of things that are happening all over the world, but the good news is we understand very well these processes and the process of how viruses make their way from wildlife into people. And our challenge now is to do the things we're doing in a much smarter and safer way, taking into account the risks that exist as we're doing these things. And in some cases, we're going to have to curb these activities, and in others, we're just going to have to put in better systems for monitoring and mitigating risk associated with them.
Thanks, John. Just going back to Neil. Neil, we've been looking at some of the costs, investments required to take these actions, to expand these efforts. You have authored a number of key papers on this as well. This has been through peer review and published and accepted. Can you just share a little bit, so what's the basic picture in terms of the costs and benefits of addressing this risk, and what's needed at the global level on that?
I'd make an analogy here to clinical medicine, right? When you look at cardiovascular disease, the recent model in US medicine has been to wait for cardiovascular events to occur and treat them in the hospital. But now there's a shift to try to go upstream and prevent cardiovascular disease by giving people access to healthy foods, spaces to exercise in, right? We would all rather prevent cardiovascular disease in the first place rather than experience that heart attack or stroke and have to get it treated in the hospital and potentially experience any type of major adverse event. And the same thing is for pandemics. We need to always be prepared for pandemics occurring. That's an inevitable part of our existence as humans and as pretty much any multicellular organism. But we can also prevent those pandemics from occurring in the first place, right? So we need to have a two-pronged approach. We need to be able to walk and chew gum at the same time. It's not that one strategy is necessarily better than the other, but the current model of just waiting for pandemics to occur and trying to respond to them and mitigate those deaths is clearly failing. Just look at recent experience in the past decade with Ebola, Zika, COVID, and now monkeypox. All of these are examples of infectious diseases that have spread despite best efforts to respond to them. Even monkeypox, right? We could not have been more prepared for a virus such as monkeypox virus, yet we saw it spread around the world, and the US leads the world in terms of cases in 2022. Right? Even though we have a stockpile here of vaccines and therapeutics and diagnostics, and we have plans around addressing monkeypox. And there's a variety of reasons why just waiting for these outbreaks, epidemics, and pandemics to occur is a recipe for disaster if we put all of our eggs in that basket. So what we're saying, in the work of our coalition and other colleagues as well, is that we need that two-pronged approach. We have to invest in preparing for these pandemics, but we also have to invest in preventing them in the first place. And I would also underscore the equity implications of this. Just waiting for pandemics to occur is going to worsen inequities. Despite best efforts, the reality is that people who are socioeconomically disadvantaged are the people who are going to have least access to therapeutics and vaccines. Right? We saw that with COVID. We saw that again with monkeypox. We're seeing it again with monkeypox. And so when you actually invest in prevention, everyone benefits, particularly people in some of the most resource-limited settings of the world. Prevention, as you saw in the video, would cost around $10 to $20 billion a year. That is a drop in the bucket compared to the cost of responding to a pandemic, which costs millions of lives and trillions of dollars. And furthermore, when we invest in prevention of pandemics, we are also mitigating climate change and biodiversity loss. Those are two existential threats that, well, clearly it's good news that now we are talking more and more about climate change, but what's going on with biodiversity does not get nearly as much attention, and these are existential threats to humanity that also can be in part addressed when we invest in pandemic prevention. So there's a win-win-win here when we do pandemic prevention.
Thanks, Neil. We'll now come to our third panelist, Ashley Arabasadi. Delighted Ashley could be with us here today. She's the Senior Director of Global Health R&D Advocacy at Research America, and comes here with many years of experience on the public health side, on the human public health side. Ashley, could you talk a little bit about why you think this doesn't get more attention from the world of public health, and more broadly sort of why One Health isn't more integrated into global public health efforts? What Neil was saying earlier about, Neil's talking about public health needs to sort of broaden to include these types of actions as well, because fundamentally they're what are driving some of the greatest risks of public health. Could you talk a little bit about that?
Yes, and thank you for being here, and thanks to my co-panelists who I've long admired and very much love to be with. So I'm Ashley Arabasadi, and I think I'm going to talk to you from my previous position, not with Research America, but I was previously with Management Sciences for Health, which is a large NGO that does development work. And when we talk about global health, we're not really talking about global health, we're talking about global human health. And I think that there's a reason why we get uncomfortable when we have to talk about how programs should be interlinked, right? It's not something that human health organizations do very easily, and there's not very many integrated programs that combine an animal health and a human health interventions in one. And I think that goes to kind of how human health has been approached through US government agencies, including USAID. They did have a few of the emerging infectious disease, their emerging pandemic threats program, which was working at stopping zoonotic spillover events, but I don't think we do it very well. And I want to just say that I know the term One Health is accepted. I think what we need to start talking about is planetary health. And that's really what John and Neil have been saying, is that we can't look at one. We can't have our siloed approaches that we normally have, especially coming from the human health side. We really need to combine climate, environment, human and animal health together to have holistic approaches that will actually work to create a better environment for all.
And actually, just building on that, so what should we be doing to achieve that, to get sort of mainstream human public health to much more actively embrace, understand, support this, invest in it?
I mean, I think that there's a lot you can do. Opportunities like this in just education, outreach, working with lawmakers as well to highlight this effort. Although I will say that some of these need to be taken with a more anthropological or sociocultural approach to ensure that we are doing things correctly, that it will also be taken up by the communities where this will be happening. I think that we can even work with our U.S. government agencies to strike the need that programs like this are new and innovative, and that there's a return on these investments under, when we're talking about the impacts that COVID-19 has had. I think that if you highlight the Health in Harmony, for example, their work in Indonesia, they were able to make huge gains in human health by addressing it holistically through kind of deforestation, climate, and environment. So I think that innovative programs like that need to be raised and championed, and also just underscore how needed they are at the moment.
Can you comment a little bit on some of the recent steps we're seeing? So with the pandemic fund that's being established, the new version of the National Bio Defense Strategy out of the White House, which has some important language on this for the first time, I think. Raj Panjabi talked about it yesterday, actually, specifically. And what's going through Congress right now painfully working its way through Congress, but actually making some progress, where there's also some important language appearing on this.
So I think the legislation you're referring to is attached as an amendment to the National Defense Authorization Act and includes a consolidated amendment that has pandemic preparedness and response, but does include language about zoonotic spillovers. I also think that last year during the COVID-19 White House briefings that were held kind of at the start of the pandemic fund, that having representation from One Health organizations and speakers was really helpful, responding to comments and any requests for information. The new pandemic fund at the World Bank is still, as Elisha knows, our civil society board member from the Global North, our civil society organization from the Global South is One Health Bangladesh.
As the alternate.
As the alternate. So getting organizations that work across these issues is imperative to having language that will actually go to address the upstream drivers of zoonotic spillover events. So it's actually, I think that you're hearing, just by the speaker, Mr. Levy, who is here talking, I think that you're already having a broad acceptance and an understanding that this needs to be considered going forward.
Great, thanks Ashley. I'm going to come to you all for questions in a moment. I do just want to just give the floor for a minute or two. We've got a very special guest with us. Benjamin Roche from France is here in town over here. Benjamin is a leading scientist in work globally on spillover and the dynamics around that and the ecology of these viruses and what's going on. He's also one of the inspirations and leaders of the initiative launched by President Macron recently, the Prezode initiative, which has significant funding from the French government, over 200 partners involved in that. We're also partners in that effort. But Benjamin, would you like to just say a couple of words and introduce yourself? Thank you.
Yeah, thanks Nigel. Hi everyone, very pleased to be here. So yeah, just to share a little bit of my experience as the leader for the Prezode initiative. So Prezode has been launched by President of France, Emmanuel Macron, about 2 years ago now. And so the goal of this initiative, which is now truly international, we have almost 200 partners through the world, as well as 17 governments. And so the goal is perfectly in line with what Nigel said at the very beginning, meaning making stronger One Health surveillance network through the world, especially in the global south, but also trying to envision a new and sustainable strategies for ecosystem management in order to make them resilient to this kind of zoonosis emergence. So to reach these objectives, we have two kinds of approaches. So the first one, of course, is a scientific one, because we have a lot of knowledge gaps on how to do these kind of things. But because we also want to have a real impact on the ground, we try to co-design these different strategies with all the different actors locally, meaning academia, of course, but NGOs, different actors from agriculture, economy, tourism, health, and so on and so forth. So this is also a way to engage all the different actors towards some prevention strategies that can really match actually the local needs. So the point also of Prezode is not to overlap with what is existing, but really to support the different initiatives at a local, national, and international scale. So this is why, with this first funding from France, so 60 million euros, we are starting to do activities this year in 5 countries, 4 countries in Africa and in Cambodia. And so we're going to extend this kind of activities next year in 5 other countries. We are also setting up a working group with the World Health Organization to develop indicators to quantify the risk of zoonosis emergence, because we think it's crucial to develop this kind of prevention strategies to be able to say that we have reduced the risk by this amount. So this is really crucial to meet the agenda. So just to conclude, so Preventing Pandemic at the Source has been the first member in the US to join the Prezode initiative, so thanks to leadership manager. We have been followed by different kind of universities, Penn State, Tufts, and many others. And so of course we invite everyone to join this initiative to make it a real success.
Thank you, Benjamin. That's fantastic. And Prezode and Benjamin are now engaging actively with the US National Academies of Science, with NIH, with various US academic institutions, universities, and so on. So another piece of the good news here is that we are going to see, I think, a very significant increase in the basic scientific understanding of the sorts of dynamics that we're talking about, which will help inform prioritization of spending under these sorts of bills that are going through Congress, the pandemic fund, and so on, so to help guide that and focus those efforts. So thank you, Benjamin, for your enormous contribution and hard work with hundreds of partners to coordinate that scientific work around the world. I just want to see what questions we have in the room here. And yeah, if you just, we're filming, so if you stand up and just say who you are, that would be great, and then ask your question. Go ahead.
Sure.
At the back there.
Michael McCusker here. Question for Mr. John Epstein. Give my regards to Bill and Catherine. I used to oversee a pandemic preparedness consortium funded by USAID called the READY Initiative that EcoHealth Alliance was a member of. Initially was largely found from lessons learned of Ebola, and then, as I'm sure you're aware, COVID-19 hit right in the middle of it, and recognizing that was well understood before around the mortality consequences of zoonotic transmission, and often the sort of retroactive analysis of, okay, let's do some lessons learned after action reviews of how transmission occurred rather than kind of getting ahead of the curve. I wonder if you could sort of speak to how COVID has either helped to galvanize the agenda or influence some of these discussions within the larger ecosystem and health architecture as we know it today, and recognizing that this forum has really helped to provide a platform. What are some of the challenges and benefits that have emerged from that? Thanks.
Yeah, that's a great question. John, you want to start, and then maybe Neil and Ashley would comment on that.
Yeah, I think, to start with this, as terrible and awful as this pandemic has been in terms of human lives impacted, economies crushed, it has brought zoonoses and One Health into the vernacular in so many parts of society where it wasn't talked about before. And I think that is perhaps a silver lining that allows us to now have a much more elevated platform from which to build new policies, to engage in much needed science to fill in some of those gaps that Benjamin mentioned earlier. And so I'm hopeful that because COVID is something that really touched lives everywhere in every sector of society, from the wealthy to the poor to policymakers to everyday people, that there's this now shared experience and common understanding that may help and certainly has brought attention to this at highest levels of policy. So that is a benefit. And now it's up to us, I think, in the scientific community to take this moment, to seize the opportunity, to start to really have a better understanding of not just where and how pandemics are likely to occur, and that's where the science is now, but we need to start to understand how often they actually do occur and go unnoticed, or I should say how often spillover is occurring that may not lead to large-scale epidemics that get noticed, but we need to have some sense of background rates so that we can now measure interventions and show that things are effective at reducing risk. That's really what's missing in my perspective from the science, but I think we have an opportunity now to work towards that.
And John, just on that last point, then I'll come to Ashley on the political moment, but EcoHealth Alliance has been doing some amazing research quantifying some of what you were just saying. Can you say a little about that?
Yeah, all the research we do is designed to understand how viruses make their way from natural reservoirs into human or animal populations, livestock populations. So from studying the ecology of the reservoirs to the nature of interactions that people have with wildlife. And one of the things we're doing now to really start to get at the question of how often spillover is happening, and it's still a big unknown, is to look at exposure rates in populations. So not just looking at the drivers of spillover, but looking in populations of people we deem to be high risk because they have a lot of contact with animals. And though it's sometimes very hard to capture a moment when infection might be happening or that moment of spillover, looking at things like antibodies against pathogens we know circulate in animals is a way to at least look for evidence that human populations are being exposed, or livestock populations are being exposed to some of these viruses that we think potentially represent a threat to emerge. And so that's one element of the research we're doing now, again using a One Health framework, is studying pathogens in wildlife, looking at exposure rates in livestock and people to try to understand in particular parts of the world what the actual background rates are or what the risk may be. And that should lead towards being able to develop interventions and measure those interventions by looking at changes in those rates.
Yeah, so we're looking at actually being able to measure the effectiveness of interventions like reducing contact with wildlife or reducing deforestation in or near a community, and what that actually does to the risk of spillover directly, measuring that in sort of real time as it's happening to better inform the sorts of investments that are needed to address this and really support this work and learn a lot more about those dynamics.
And I just want to add that this work takes time. I mean, we're talking about establishing baseline understanding of spillover, but it's where we need to go. It's where we need to be if we're going to really talk about efficacy of interventions and really kind of validate the approach we're using.
Yeah, thank you, John.
Well, I know you thought a lot about this as well.
Yeah, actually, to the question on the political moment, the policy interest that there has been on this, yet COVID is sort of going into the rearview mirror, thankfully in many ways, not really in practice for many people, of course, but for politicians it is. How do you see that affecting the policy and the politics around all of this and efforts to address these issues and generate attention and resources to address? So there's a less chance of this happening again.
No, we've been talking with a bunch of former congressional staffers on this issue specifically, on COVID-19, pandemic preparedness, what's resonating and what's not. And unilaterally, across both sides, Republicans and Democrats, they've said, don't talk about pandemic preparedness anymore. We're tired of it. We don't want to think about it. We don't want to talk about COVID-19. And instead, what they've suggested, because we're not to drop it all together, because this is an important topic, is to pivot to say from lessons learned that because of COVID, this is what we've learned. These are the investments that we need to make to enhance U.S. national biosecurity, national security issues. I will say one thing to John's point into to kind of the COVID-19 response. I will say that investments in research and development, particularly with mRNA over the past decade, led to the ability for the U.S. and the private sector, which is absent in a lot of conversations, which I think we need to call out, to develop tools, namely vaccines, for distribution quite rapidly. And it was those investments from the U.S. over a period of time that led us to be in the position that we were, so that we could quickly scale up those operations. And I would say that we need to be doing that for more classes. And that this is my new job, so just bear with me. I've only been there a few weeks. Of kind of those vaccines that don't have high market ability, that aren't very kind of, they're not going to generate a lot of wealth, but there's still research and investment in that still needs to happen.
Thanks, Ashley. Neil, any comments on the politics? And then there was a question back here. I'll go and, all right. Yeah, quickly, Neil, we've got some good questions coming up.
I'll just say, we do have this moment right now, right, with the pandemic fund or the pandemic accord being negotiated, but there's a very big risk that prevention will be excluded. The focus is all too often on preparedness, and again, I'm not saying that preparedness is not important. We have to invest in preparedness, but we can't just put our eggs in that basket. We also have to invest in prevention, and you see this in groups like the Bipartisan Commission on Biodefense, Bill Gates. They only talk about after the point of spillover, and that's a dangerous proposition. Lives are at stake if we don't think comprehensively about the full risk that pandemics pose.
Thanks, Neil. Go ahead and please introduce yourself. I'll take all the questions. We've got you and another one and then two over here. We'll take all of them. Go ahead, please.
So my name is Megan Livingston. I head business development for a startup called Gerada Thin Film. We are commercializing a technology that stabilizes vaccines and biologics at ambient temperature, completely removing the need for cold chain in distribution. So I have a couple of questions, if allowed. One is curiosity and one is more of an offer kind of thing. And Ashley, your point actually ties directly into this. So to the figure you guys gave of $10 to $20 billion investment per year needed to prevent these pandemics from occurring, where would that money be allocated? Or where, based on the calculations, where would be best to invest in order to prevent these things from occurring? And then my second question is to the mention of prevention. What do you need from the private sector, biotech and pharmaceutical companies, in order to prevent these things from happening?
Great, thanks. Go ahead.
I'm taking them off right
Yeah, I'll take all the questions because we might get some interconnectedness.
Hi, my name is Mandy Slutzker. I am with the American Academy of Pediatrics. The question I'm asking really has not so much to do with pediatrics, but policy. So you mentioned anthropological, all of that. In the beginning of the COVID-19 pandemic, I had the sense that US lawmakers felt it was very easy to kind of point the finger at China and say, oh, it's your wet markets that caused this. And it's a lot easier for us to pass resolutions that have no legal binding in other countries. But I'm wondering about in this country specifically with how livestock is treated, you know, cows, chickens, everything. Is there an effort to regulate that better? And how do you combat the big lobby groups that make up, you know, our livestock?
we will definitely pick that question up. Yeah, go ahead, please.
Hi, Colin Puzo-Smith with Results, and actually, I was going to ask the exact question. Former colleagues and thinking about the same question. So, but I had two. I won't ask that one, but really curious about sort of like private interests, livestock, logging, like all the folks who stand to make money from deforestation, plenty of other things. But then my second question, to the point you made earlier, Ashley, about a lot of us in global health are actually talking about global human health. That's very much me. I'd be curious if there are health system level interventions that you would put at the top of the list, whether that's like community level interventions or primary or secondary care. Like, are there things that the health system can be doing differently to complement the sort of larger social, business, systemic changes?
That's great, thank you. And one more here, and then we'll come back to you, Courtney, and then we'll come back to the panel. Go ahead, please.
Yeah, hi, Barbara Seligman from the Population Reference Bureau's fascinating panel. So my question is, in looking at some of the many lessons learned and recommendations that have been distilled around the COVID experience, there seems to be an absence of discussion about population and societal factors. And I wonder, Neil, you touched on some of this, changing demands for animal protein, where people get their, where they get their food, internal movement, accelerating growth of urban areas. That's something we're really going to see happen tremendously over the next decade. And it just strikes me that this omission is a really unfortunate one, and one that I would imagine that the folks around this table would be very concerned about. And we're very interested in joining those efforts, especially on the population side.
Fantastic, thank you. And Courtney?
I'm Courtney Dusenberry with the Task Force for Global Health. I just wanted to modify your question to say health system and public health system.
Yeah.
Thank you.
Yep.
Great, thank you. Was there another one? Did I miss somebody?
Sorry.
I'm sorry, yeah,
It's
please.
okay. Hi, I'm Julie Fisher, CRDF Global, and I'm with the Global Health Security Agenda Consortium, where I succeeded Ashley, actually. I wanted to just come back, actually one of my questions was the question you asked about the private sector, but also coming back to the point of learning from and adapting interventions that have proved successful. Even in the gorgeous video, one of the examples cited was what Thailand has done with, at the very immediate community level, at the village level, training and engaging what were previously village health workers as essentially what started out as the X-ray initiative to detect cases of potential avian influenza while they were still at a very small scale in animals. And that has expanded and been built on into some of the after-event program that was discussed in the video. But this is an example of a program that has been successful, and it's been successful because it got community buy-in. has to some degree bypassed the private sector, but has engaged people at the community level and gotten their buy-in to thinking that this is an important role to play. Just as you should promote vaccines, you should promote awareness of disease in animals that could spill over into people. But it is not one that has been really replicated, has been published about, has been widely circulated. So what can we do while your research is going on to find ways to reduce the threat of spillover, to share some of those practices that have, and those interventions that have been effective, and increase testing of them so that they can be rolled out in a variety of economic and development settings?
Yeah, thank you. That's a great question. All right, that's a lot. Let's and that's all super high quality. So I've written it down. I'm going to just pick on people and I'll throw some of these at you so that we try to get it. So the $10 to $20 billion a year, Neil, what is that for? Can you break that down a little bit?
Yeah, so there was a major paper that colleagues of ours wrote in 2020 in Science that breaks down the cost for that 10 to 20 billion, but it's basically split among a variety of different activities. Number one would be addressing deforestation. If you look at the Brazilian Amazon, amazing reductions in annual rates of deforestation were achieved. 70% reduction in annual deforestation from 2004 through 2012 with an investment of $1 billion a year. Right? That is a drop in the bucket to save so much of the Amazon. So that's one line item. Number two would be addressing wildlife markets and trade, and a big part of that would be focused on efforts to help China, because a lot of people depend on wildlife markets and trade in China for income, etc. So making sure that these people who are engaged in that have alternative livelihoods to pursue. Number three would be in improving surveillance so that we have early detection. This gets back to, I think, maybe, Julie, what you were referring to in Thailand, but you want to have quick detection at where spillover first happens so that you can do rapid containment efforts. And number four would be improving biosecurity when raising farmed animals. And I think this gets back to your question about livestock, and there's a lot more to say on that. But these are some of the major actions that we need to take to reduce spillover events.
Yeah, and I'll just add to that, some of that figure was specifically to build capacity in wildlife sector for surveillance among wildlife. It's one of the things that's been the most far behind in terms of public health. There's great human surveillance, variable obviously, livestock, they're more virtually nothing in wildlife. So part of that figure was to support that sector in doing surveillance in wildlife.
Two examples. One, I think, was Liberia pre or around the time of Ebola had one veterinarian in the entire country. So it is, it's a capacity. It's a capacity issue. But for Julie's, Management Sciences for Health had a pilot program years ago in Rwanda where they worked with animal health community workers to set up an early warning system, which would have emergency alert if there was a sick animal, and that kind of fed up to the district level with plans to go to the national level. It wasn't funded, which is that's an issue. But it was really an interesting way to have the veterinary system and the human health system work in tandem with that kind of technology interface.
Next question. Ashley, the point that came up over here about the sort of health system-wide interventions, public health system-wide. Anything, any thoughts? It's a big question. But we are trying to get at some of the deeper issues here and systemic issues. Any thoughts on that?
I mean, we know in the U.S. Where our health system was valued very, very highly for the National Security Index and how hard COVID hit us. But we also know in low and middle income countries that don't have a functioning health system, or its health system is at a reduced rate, that disasters such as COVID or natural disasters takes longer for one, a response, and two, to become resilient from that episode, right? So if we're talking about infectious diseases specifically, one of the things that the Pandemic Fund and USAID, CDC, et cetera, it's not only capacity building, health workforce, surveillance, of having the ability, the pharmaceutical supply chain. If we have a vaccine, to your point, that needs to be stored at a certain degree, we can't get that to where it needs to go to the last mile. So pretty much the health systems at all levels for human health needs to be considered here.
Yeah, and we're painfully aware of limitations on the human health system side. on the animal health system side for livestock, far, far worse. Yeah, John?
Absolutely. That farming is often about bottom line and costs, and animal health and veterinary care is often the first thing that goes, or isn't even existent, whether there's no capacity for it or farmers are just unwilling to spend money on it. And so livestock health is something that is desperately needed in much of the world, and we go a long way towards prevention systemically.
Yeah, and just think about what that actually translates into. So that's pandemic risk, infection risk, but it's also massive
security.
impact on food security, livelihoods, right? Farmers whose chickens are unhealthy have a lot less money from selling those chickens, and then you've got other risks that are coming. So then they are driven to engage in other behaviors potentially, like as we see with the Health in Harmony work, potentially illegal logging and clearing of forests and so on, which generates other risks and other dangers on the health side and to those communities. So there's a whole set of interconnected issues here, which investment in this would help to address.
I would also say, not to put my colleague on the spot, but we haven't talked about the importance of access to clean water, both for animals and for humans, especially in health outposts.
Yeah.
Like Danielle, I have to call you out for that, who works at, is it WaterAid?
Yes.
Yes. When there was a great article years ago by Eric Starbuck of Save the Children, who said, in the event of a pandemic influenza and there's no vaccine or other therapeutics available, the only thing that we'll be able to do is, one, social distance, and two, have access to clean water for basic sanitation and hygiene. So when you take one of those out, this was the exact scenario that we were in for COVID-19 and a lot of those low and middle income countries.
And climate change significantly exacerbates poor access to clean water because of changes in rainfall patterns, and deforestation and so on contribute to climate change. So we get into some very serious issues there.
Nigel, can I just quickly add two things though? Just on education needs to be reformed, because medical professionals in particular are not taught about ecology and veterinary medicine. There's an effort that's led by medical students right now in the US to grade medical schools on how well they are teaching planetary health. So we need to completely rethink how people are being taught. And number two is, we again are pitting conservation against public health all too often. I see that in the philanthropy space, where philanthropists say, I want to fund only public health, not conservation. But when you say rainforest, you're contributing to public health. They're two sides of the same coin.
Yeah. Pointing the finger at China has not been a great strategy for dealing with pandemic prevention and preparedness. That's, I think, one of the lessons that we have learned. So thank you for bringing that up. I was at a major meeting in Asia recently, and where the stark contrast was made between SARS-1 15, 20 years ago, where there was very strong cooperation with the Chinese government to investigate and work on the origins of that, and COVID-19, where there's, to quote people at that conference who are trying to do this, there's absolutely no chance of that ever happening now with China on this particular pandemic because of the politicization that's taken place. So coming back then to the US domestic side, the livestock industry, food systems, right? There's, over the course of a year, over 80 billion chickens are grown and consumed around the world. Livestock make up 75% of the mammal mass on Earth, livestock and humans. Basically, we've displaced almost all other mammals on the planet in terms of mass. So this is really driving major risks. We see it very clearly with the flu pandemics. Would anyone like to talk about the need to engage on those issues with the meat industry and the power of some of those lobbies and interest groups as barriers to addressing some of the issues here?
Well, I can start with farming systems, because this is what we're seeing now is an explosion in certain parts of the world of intensified farming, and that clearly presents risks. What I will say is that in many parts of the world, particularly in the West, when you have industrialized or intensive farmings, and saying nothing about welfare per se, but in terms of biosecurity, they tend to have pretty good biosecurity. They're not immune to infectious disease outbreaks, but for the size of the animal populations that are maintained on these farms, there's, in some cases, there's rigorous attention to biosecurity, which is good. Sometimes the risk lies in the more intermediate sized or even smaller farms where livestock are moving around and intermingling with wildlife, and there's less attention paid to the contact that they may have or the risk of exposure to pathogens carried by wildlife. So influenza viruses, which still remain a very big threat in terms of global public health, are carried by migratory waterfowl. And so in systems around the world where there are backyard poultry farms or intermediate-sized poultry farms where ducks and chickens, domestic ones, intermingle with free-ranging migratory waterfowl, there's plenty of opportunity for spillover of these viruses. And then those domestic poultry get moved into bigger and bigger systems, and if they're infected, it can seed outbreaks. And so biosecurity really is an important issue, and it's something that needs to be addressed through education and through systemic practices, particularly in parts of the world where livestock is being intensified. That's a separate issue from perhaps reducing demand for animal protein, which probably will solve some problems too. But as things are intensifying, we do have to pay attention to that, to biosecurity.
Anyone else on this?
Okay. That's very good. I was just going to say, for the Capitol Hill aspect, I know that a few years ago, Senator Gillibrand was really interested in the issue of antimicrobial resistance, and she was also on the Agricultural Committee. So there are some people that there are some members that are interested. I think that to bring this issue up more broadly, I think we're at a moment, and especially in the next election, 2024, we're at a really pivotal moment for global health, for planetary health, climate, and the environment, and it's going to be tough. It really is. So we're just champion building, realizing that we need to kind of tweak our messaging to resonate a little bit more, and just keep beating the drum.
But we also have to examine profit structures. The same thing that happens with climate change is happening in pandemics. In climate, 30% of the solution towards stabilizing global temperatures to just 1.5 to 2 Celsius of warming comes from nature-based solutions such as saving rainforests, yet that receives less than 3% of funds for climate mitigation. And we're seeing, because you don't make money off of saving rainforests in the same way that you make money off of building battery cells, etc. Same thing on the pandemic side. You don't make money off of many of the things that we're talking about when we're saying save rainforests or address wildlife trade. And so, these are a major uphill battle, but I fully agree that there are entrenched interests.
We've talked a little bit about having a COP moment for pandemics, or a COP approach to this issue of raising it up at the highest levels of government as well. They just having a metric to measure against and having it in the public eye. I mean, yeah.
Nigel, could I just bring up a quick example of private sector engagement and economic motivations for protecting biodiversity? One approach that we took, doing some work in the state of Sabah in Malaysian Borneo over the past few years, was looking at deforestation that occurs for agricultural purposes. So oil palm, cocoa, previously it was rubber, but the idea of converting diversity-rich forest into commercialized agricultural landscapes presents risk for spillover. And we were able to use an economic modeling approach to present the idea of damages associated with triggering an epidemic to private sector industry that were, undertaking deforestation, and getting to think about the idea that you could actually choose to alter landscapes, and not all landscapes are equal. Some have a lot of biodiversity and may present more risk in terms of leading to epidemics, which has bottom line costs to your workforce, to local government infrastructure. That the health damages associated with that are measurable and incalculable. So we can present economic models that show that, hey, this piece of land that presents less risk for an epidemic might be preferable in terms of utilization compared to this biodiversity-rich area that we should protect. And that is going to help your bottom line and avert or avoid future damages. And we saw that resonated with industries because it wasn't telling them to just stop doing what they're doing, but to be smarter about it, and that there was an economic incentive that had public health and conservation benefits. We also saw it resonate with government state government in this case that was permitting land use by different industries. So that seemed to be a promising approach, is to work with industry and doing things in a safer and smarter way.
Great, thanks, John. We need to start to wrap up here. So I'm gonna touch quickly on a couple of the other points that came up. Then I'm going to come to each of you for a closing minute, and then we'll wrap up. A couple of things we didn't cover here on the population protein food system question. That is incredibly important. We just heard a little bit about some of the issues with intensive livestock production. I think we're familiar with those. That needs much more work. So looking at alternative protein sources, gradually encouraging a shift, particularly in countries where people are over-consuming animal protein, to more plant-based diets. That doesn't mean everyone becomes a vegetarian, but just slowly, step by step, why aren't governments nudging us gently to start to move in that direction? It has so many benefits, not only for but we know all about non-communicable disease issues associated with this as well, climate change, land use, workers' rights issues, and so on. So that's something that we are very engaged in and looking to actually do a lot more work on. We don't see the absolute population level as the issue, much more the behavior of people, and particularly overconsumption issues in the global north are driving a lot of these issues. So that's a key area. And the last point, just on the sort of the scale up, the replication of successful solutions and models. We talked about the Thailand example and so on. That's where we're really looking to the World Bank Fund, Elisha.
Out of the room.
Yes, the board member leaves the room. Really looking to the World Bank Fund, to the new global accord which is being negotiated under the WHO, to do more to incorporate some of these primary prevention actions into the agreements that are being made, into the terms of reference for the fund and so on. And much more work is needed on that, so that some of that funding can go to testing, scaling, learning from the many promising examples that are out there. We think there are a bunch of quick wins out there. We have a paper on this that's coming out soon that goes through some of the examples, like the Thailand example. By the way, all of this stuff is on our website, including the papers that we talked about. So preventingfuturepandemics.org. If you go there, you can find all this material. You can sign up to our mailing list, so please go there. If you want to know more, let's just go down the line for some last comments. Neil, starting with you.
I guess I would just say, first of all, thank you to all of you and Nigel and my co-panelists for this opportunity. And right now we are facing the convergence of three catastrophic threats: climate change, loss of biodiversity, and pandemics, that at their core all have a common etiology, which is the destruction of nature. And we have a decade left to turn this around, and we have to start seeing conservation as an issue of public health.
John.
I think we have to recognize that the solutions here are going to require partnerships. We have to continue to invest and even increase our investment in building capacity in parts of the world that are most vulnerable to emerging diseases and that stand to really do the most to prevent spillover and protect the rest of the world. So we have to get out of this panic and neglect cycle where we only throw money at problems when they're in crisis, and we need sustained investment working with local partners in countries where diseases tend to emerge.
Thanks, John. Ashley.
From my perspective, we need to have a dual-facing approach. One is to build new champions for those who can create policies or fully fund our government agencies. And the other is to continue to work with agencies to highlight the need for more integrated programs, human, animal, climate, and environment programs to solve some of these issues.
Thank you very much. I think you touched on all the key points I was going to make at the end here. There's a long way to go on this still. We're gaining traction, we're building support, but we're really counting on all of you here to join this effort. So if this resonates, if it's of interest, visit our website, join our coalition. Let us know you're interested. We are keen to diversify our efforts and incorporate other perspectives as we build support for this in Washington, D.C., Europe, Indonesia, around the world. We need a lot more people to join this effort. Thank you all for joining us and for being here. Thanks to our panelists. Have a great afternoon.